Good afternoon, everyone. Good afternoon, Minnesota. This past 10 days or so has shown the world the worst and some of the best that Minnesota has to offer. While the Floyd family, their personal grief of watching a memorial service yesterday, and they also had to do it in the context that the world was watching, and the opportunity to talk about what's next, what's the road forward, what does this mean, was very clear. This morning I had the opportunity to go out with community leaders. Some of that means elected officials, some of it means community leaders who are organically risen to that, and then business owners up in North Minneapolis, on Broadway, down on Lake Street. I want to say a specific thank you to some folks. You don't always see these sometimes in the legislature, but I can tell you they have risen to the occasion this last week. Senators Champion and Hayden, Senators Torres Ray, they were my hosts this morning. They were joined by Senator Disick. Also hosting was Representative Gomez, Hassan, Dean, and Dabney, and someone I've really appreciate, and I think certainly Hennepin County, but I would argue Minnesota is well served by County Commissioner Angela Connolly, who's been relentlessly trying to rebuild her community, and City Councilman member Jeremiah Ellison. They took me down there and we had informal talks, and it was, for Minnesotans not in the area or who've just seen the pictures on TV, it's one thing to see them, it's another to walk with a business owner who family has been there over 100 years and their business is no longer there. Or an immigrant business owner who started it with their savings 25 years ago to start a furniture store and to stand in what is a burned out building in a hole in the ground. And what that means, it becomes far more than just the property, because as we said, we are very lucky and we're very blessed that after George Floyd's murder, we didn't lose anybody else in this. But the destruction in the families is one thing. But this morning, and there was a lot of folks down there and numerous stories, the sense of hopefulness in a time that you may not believe that was there was overwhelming. Had a distillery owner tell me, Chris was saying, he was excited when he first did this. He's a pretty young guy. He said, I was excited when I started my first business, and anybody who's done it, it's the thrill of doing that and building something and getting it going. And that's gone now. But he said the thought of rebuilding in a new environment with the changes that are coming is even more exciting about what it can mean. That's pretty impressive. And then they talked about the reality of this. He said, yeah, I was severely undercapitalized. Most black-owned businesses are deeply undercapitalized, which meant they had not enough insurance. He also made some notes that I think, once again, the issues that Minnesotans are grappling with. Statistically, he said, if you go out there and ask for venture capital for a business like this, the average is about $1 million you'll get. Unless you're a woman of color, you'll get $47,000. Based on nothing else, nothing in the back. So he talked about, if we're talking about rebuilding, this is going to be a key piece of it. The fear that was echoed is that these businesses will leave and take the culture with them, that these businesses won't be able to rebuild, not just from an economic standpoint, but from a cultural standpoint. And the fear was echoed in the belief that if we don't do this right, and people end up selling these properties out, that the gentrification will destroy what was the unique culture of this area. And so there's a thoughtfulness on the ground, on the areas that extend, of course, on accountability on policing and criminal justice reform, but all of those issues. But then coming back to the businesses, how do you build into the community? So I have to tell you, it was gratifying, it was helpful, it was a challenge to all of us of what we're going to do. But the spirit of community there is strong, and I hope those are the stories that now get to told more and more often. I'd also like to say how grateful I am to the Minneapolis City Council for acting in an unprecedented manner on the commissioner's charge. Commissioner Lucero is here to talk to us a little bit about economics and equity in economics, but he'll certainly be able to answer some questions on the commissioner's charge. Things that have happened, and this morning the first one I saw as I'm getting briefed as I'm doing things, that the city of Minneapolis has banned chokeholds from the police department. When I hear that, the first thing I just have to be honest is that's a pretty damn low bar just to start with in terms of that we hadn't had that. But to think about this, that's in many communities. And it took this to get it done. And community activists, and I want to call this out, community activists who've been asking for these changes that can be made in the short term and then the systemic changes, this is how fast it can happen if you do it right. And I want to just be very clear to make sure that people know that the work that Commissioner Lucero and the Minnesota Department of Human Rights did was based on the legwork and the blood, sweat, and tears of activists over decades to try and formulate what works and what can change how we look at our communities. That's a really important part of this, that the Minnesota Department of Human Rights and the announcement we made last week was a catalyst to put in place what already happened in the Minneapolis City Council, which will then trickle down and need to be enforced into the culture of how we do policing. That's a pretty big change if you think about it. It was not forbidden to do a chokehold yesterday. Now today they put it in and it is. So those who think that now is not the right time, and those who think that we need to think about this a little longer, have certainly not been paying attention. And if you needed the wake-up call, it happened last Monday and continues to right now. And then I'd like to talk about where we're at as a state, thinking about all of the things that can move together. We're going to have an announcement today in the midst of COVID-19, and many of you in the media and others have been still tracking this. We're still making sure that, again, as we started, we knew that when COVID-19 came here and when the pandemic started to spread by mid-February to early March, that the United States was not prepared, state of Minnesota wasn't prepared, that the transmissibility of this and the danger it posed to certain populations had the potential to overwhelm hospitals as it had in Italy, as it had in Spain, as it had in New York City, and that we needed to create the space to be able to build up hospital capacity, to build up PPE, and then probably most importantly, learn how we live with it for the long haul until we get immunity or we get the vaccine. And that's just what Minnesota has been doing. And today we're prepared to take another step of turning that dial. And I'm going to have Commissioner Grove, Commissioner Malcolm explain in greater detail. But starting next Wednesday, June 10th, we will be turning that dial. We'll head back into our restaurants with some capacity restrictions that will be in place, gyms, fitness studios, other operations. We believe we should be able to handle this. We're looking at it. I'm not going to say, and I think Commissioner Malcolm will be the first one to say it, we can't get complacent and we can't get lazy around what will happen here. We're going to really need to once again ask people to help make this work. This is the personal responsibility piece. If we all pack back in and we get next together and we know that these last 10 days have been difficult with that, we're going to hear Commissioner Lucero talk about how we will do that. We're going to make sure that we're not asking workers to go back into unsafe conditions without providing them the testing and the tracing and the isolation, and to make sure the hospital capacity is there for when they need it. These steps will be critically important. Commissioner Malcolm will be announcing, we passed 11,000 tests yesterday, even in the midst of what's happening in the confusions. We have the capacity now to reach those numbers we talked about. The idea just a month ago that we could test over 10,000 people on a daily basis was that moonshot we were looking for. Now we're ramping closer to, at the height of this, we'd like to get up to over 20,000 if that's what we need. And I think what Minnesotans need to remember is we may need to do this till next February or March or whenever that time comes, but that doesn't mean we can't be smart about how we roll back into businesses. We'll talk about swimming pools being able to open. We'll talk about what youth sports look like. We'll talk about indoor activities like theaters and those types of things that we can do, and look where our movement is and what it means if we get the spike, what it means if we see down the road here 10 days or so from what's happened this week, if we're going to see that. But I'd like to say one of the things, and this is gratifying to me, I talked earlier about those representatives that sometimes you don't hear that much about, but the way the system works is these are people that are on the ground. I was getting texts at 2:30 a.m. for people standing next to burning gas stations. I got text and calls, and I talked to Jeremiah Ellison, who put Trey on the phone, who owned a barber shop, and he's on the phone this morning telling us about what happened. He and his council member were out there throwing buckets of water on a fire in his shop when this is happening. That's neighbor to neighbor. This is what it was about, and then telling us what they need to do to rebuild. And then I have to tell you, out in greater Minnesota, about this idea, how do we reopen again? How do we get there? Dave Lisselgard's a member of Minnesota House from up north. He was the mayor of Aurora. He's a union guy. Just one of these members of the House that you don't hear about in the paper a lot because they're just a grind it out, do the work type of person. He has been funneling things from business owners who are saying this, who want to reopen safely. They're concerned about, are they going to be viable afterwards? They don't have a lot of cases up and around their Hibbing area or wherever they're talking about. He's conveying back through his leadership and directly to me what needed to be done and telling us this is what needs to happen. So I want to thank, there's lots of them, but if the example today of what it looked like Dave Lisselgard making that case and trying to get this right. And so we're excited about this. You're going to hear them talk about, Commissioner Harrington will talk about it, and he will say, and I'll talk more about this, about removing the curfews, because Minnesotans and here in Minneapolis and St. Paul and the surrounding areas have shown that they've risen to the occasion. This is their city. It will be done the way they want to see things done in terms of respectful protest being at the heart of the change that needs to come. So I think with that being said, that worst part we saw earlier in the week and the best that Minnesota has to offer, we have that chance now. We have the chance to change the culture around police brutality. We have the chance to change around how communities interact with their police and with law enforcement. We have the opportunity to change how Minnesotans start to move back into a sense of operations around more economic activities and taking ownership for our neighbors and personal responsibility. All of that is upon us right now, and I think this announcement will really help. And with that, I'd like to have Commissioner Grove go into some greater detail.
Well, thank you, Governor. Good afternoon, everyone. Happy to be here today. And I want to say before we begin going into the details of this order, our Department of Employment and Economic Development has been honored this last week to work very closely with many legislators in the affected districts that were hurt very badly by the protests and riots we saw unfold. And been having lots of really helpful, difficult but helpful conversations with legislators, community leaders, city officials, economic development leaders on what a response can look like. And we're beginning to move forward with a disaster declaration that will help free up some funding from the SBA, but we know much more is needed. And so those conversations are going to continue in partnership between our agency and legislators, and it's the business owners themselves that are telling us what they need most, and then we're going to work with very closely to respond and bring back these neighborhoods in the way the governor described. Before I get into some of the details on the reopening announcement that the governor mentioned a moment ago, I just want to do as we always do here in these moments of turning the dial and just thank our business community across the state. It has been nothing short of amazing how our small businesses and businesses really of all sizes across Minnesota have truly sacrificed over the past few months to help us stop the spread of COVID-19. And that has allowed our hospital system, has allowed our critical care capacity to respond and prepare for this increase in cases and allow us to ensure more Minnesotans can stay alive. And that has come at a great deal of sacrifice to so many businesses across the state. And not only have they been willing to stay shut down and help us grow our capacity, but they've found ways to contribute to their communities, whether it's changing their supply chains to build materials like masks or PPE that we need, or championing local food drives in their communities to help students and others in their communities get through this, or helping their workers make it through. We've just been so impressed by the partnership of the business community in our state, as well as helping us build these guidelines in a way that we think will work for the economy moving forward. As we've shown many times at these press conferences, we have a model here that is focused on dials in both workplace and social settings. We are moving those dials today to increase activity in our economy. As always, though, we are not going back to normal, and we remain in a world that COVID is a major factor in our lives. And so we're continuing to ask really for personal responsibility throughout this next phase. That means wearing a mask when you're out in public, staying 6 feet away from each other when you're in groups, and really staying at home if you feel sick or have any symptoms. That is really critical to making sure we can turn these dials, do so carefully, and continue to mitigate the spread of this disease, yet bring back many sectors of our economy. And so Commissioner Malcolm will talk more about that in a moment, but I did just want to say that as we turn these dials, we want to remain very vigilant and careful to stop the spread of COVID-19. So there are some broad principles that we're bringing to this next phase that apply really to all settings. The first is that social distancing requirements come first. That need to stay 6 feet apart, to practice sanitation protocols, to wear masks, to be careful. That is the bedrock principle of every single move that is made across this dial. As well, we're looking at capacity limits for various settings. These capacity limits are always based on the fire marshal's occupancy restrictions for a given setting, and the percentages that we'll walk through in a moment are really based on the type of contact that exists in a given setting, the length of that contact, and then the predictability of that environment, as we've talked about before. So different settings are different, and so different capacity restrictions will apply to those settings accordingly. And then the third sort of main principle here that we want to refer to is simply that the maximum amount of people in any organized setting here is 250, and that essentially demonstrates that we're not opening large settings here. We're keeping settings at a cap of 250, and that will apply to so many of the industries I'm about to walk through. So the first shift that we're going to make starting next Wednesday, June 10th, is to increase the gathering limit for outdoors. That's up to 25 people that can now gather outdoors. It was previously 10. The gathering limit will remain at 10 for indoors, given the virus spreads more quickly indoors. And we're asking that social distancing be used in all those gatherings, and we're strongly encouraging Minnesotans to wear masks. The next sector we want to address is restaurants and bars. We are now moving beyond just outdoor seating and into indoor seating as well, up to 50% capacity of your indoor facility with a maximum of 250 people indoors. The outdoor limit will also be 250. Previously it was 50, so you'll be able to have up to 250 outside and 250 inside. Many restaurants aren't that large, but we thought it prudent to have a cap. We are requiring workers to wear masks, strongly encouraging customers to wear masks. And I know that sounds somewhat awkward in a situation in which you're eating and drinking, but it's so important for the safety of those workers that when you're giving your order to the waitress or you're walking into the restaurant and transitioning into your seated area, that you wear that mask to really keep workers safe. They'll be required to wear them. We strongly encourage customers to do so as well. That reservation requirement remains. That allows for more safe and predictable movements within a restaurant setting. The next shift in terms of advancing businesses that are currently opening to a new level focuses on personal care services. This is hair salons, nail salons, barbershops, what have you. These were previously at 25% capacity. We're popping that up to 50% capacity. Both the patron and the worker must wear a mask given the sustained, very close contact that predominates those settings, and again, reservations required. Places of worship, the change here is to advance the percentage capacity up to 50%. Other than that, all things remain the same. 250 people max inside a contained area, and outdoors, 250 people allowed to congregate and worship together there. Now, there are some settings that have not been open up till now that will be opened with this executive order, again, starting next Wednesday. And the first of those are gyms and fitness centers. These activities, of course, require a lot of physical exertion. The environment's a little bit more dynamic and less predictable. The disease, of course, spreads through airborne particles, which increase through exercise. So the capacity limit here is 25%. Again, the max cap is 250. We're asking people to stay, again, 6 feet apart. Really encouraging you to wear a mask, again, to and from the gym and in between activities there. Of course, when you're exercising, that's somewhat impractical, but wear it as often as you can. Group exercise classes will be allowed. If social distancing can be maintained, we encourage gyms to think about outdoor classes, of course, in the summer as the weather's gotten nice, and again, encouraging social distancing in all cases. We also made a move to turn the dial on entertainment venues. That was originally a part of Phase 4, but as we looked across the board at all the settings we were looking at for Phase 3, it did make sense to consider entertainment venues as well. And by that I mean movie theaters, bowling alleys, arcades, museums, these sorts of settings that are indoor entertainment. And we're opening those up at a capacity rate of 25%, again, not to exceed 250. And there's some differences here. Sitting in a movie theater is obviously different than going to a bowling alley. The limits are the same, but you'll see on the website some different guidance documents for seated recreation versus, or seated entertainment rather, versus recreational entertainment, just to give a nod to some of the different things to consider in those environments, and lots of good conversations with industry leaders there to develop that guidance. Outdoor entertainment, you're talking about movies in the park, outdoor concerts, et cetera, they will be able to resume at a maximum capacity of 250 people. As the governor mentioned, pools open again at 50% capacity. The health guidance shows us that the disease is not spread through water, which is great. Of course, social distancing must be followed in all settings, and particularly pools, but at 50% capacity, we feel comfortable opening up those settings as well. Now, with the increase in gathering limits of up to 25, that has some implications for sports that I wanted to talk through. And we know Minnesotans are active and it's summer, and so lots of good and I think thoughtful questions about what this all means for sports. With 25 being the cap, you can imagine 11 on 11 types of sports being able to happen, both for youth and adults. There's, of course, a different type of activity, though, in different types of sports. You have low-risk sports like tennis, where you're, by definition, quite a bit apart, and you got high-risk sports like basketball, where you're very, very close. And so low-risk sports are now moving into a phase where games and competitions are possible, again, with those social distancing requirements in place. And for high-risk sports, practice in engaging in the activity is allowed, but not games and competitions because of the significant contact. And there's lengthy and quite detailed guidance on the specifics and what's a low risk and a high risk sport in our guidance documents, but wanted to highlight that basic difference here, as sports are something that I know so many people are asking about and care about as we head into summer. We will also continue to retain the guidance that if you can work from home, you must continue to do so. This is one of those things that it just allows us to limit the amount of contact that's possible, and it's critical for those workers and those businesses who can have workers to work from home to be able to allow them to do that. The other piece of this is planning, and we've said from the very beginning that we've learned a lot from the businesses out there who've always been in business and have been looking for ways to make both their employees and customers safe. And so many businesses that we've talked to who've been navigating this pandemic have plans in place, right? They have plans for how traffic flow should work, how masks should work, how health screening should work. And that's really a critical part of not only keeping people safe, but building the kind of consumer confidence you need to make an economy work. Without that confidence, customers aren't going to want to come out. They're not going to want to come and engage in commerce. And so plans are really critical to getting this right. Up till now, we've just been requiring those plans for new non-critical sectors that come back into the market. But at this point, with the broad, sort of expansive set of reopenings we're announcing today, it just makes sense for every business to have a plan. And I think, for many of the businesses, this is not going to be any kind of a change because they already have one. But if you don't, and you're a critical sector business, today's executive order requires you to have one by the end of this month, so by June 29th. It also requires our departments of labor and health and deed to have additional guidance documents online by June 15th. It will help in the development of those plans. Again, if they haven't been created yet, we'll have those live by the middle of this month, and there's a 2-week period where you can create them. You don't got to pause operations until you make your plan. Nothing has to change about how your day-to-day is going in terms of the plans right now, but again, this will be really drawn from CDC guidelines and help ensure consumer and employee confidence as we move into this next phase. So that's really the whole of the announcement today in terms of the executive order. A lot more details will be published online very shortly. We'll have a new website to roll out, and we'll share that information soon. This is a moment where I think we're really counting on Minnesotans to be able to re-engage in their economy, to go out and begin to engage in commerce in ways that they couldn't before, and to spend money in ways they couldn't before. And I think we're really counting on Minnesotans to get this right as it comes to social distancing and masks and being careful. And we've seen so much great togetherness in our state around that factor, and we'll continue to see it moving forward. Last thing I wanted to mention today that is unrelated to the reopening, but I think it's important to share, is that we are now in a phase of our unemployment insurance program where we're going to begin to transition to federal funding. And this is necessary because based on the clip at which we're spending our state trust fund, we expect that trust fund to go negative in early July. And so we're proactively addressing that by sending a letter to the Department of Labor to begin to draw down federal funding to pay those benefits. It will not change any of the benefit amounts or pace or efficiency of the benefits people receive. Many states have already done this, so this is a very common thing. We expect all states will have done this by the end of this pandemic. And it's just an important way to make sure we can continue to help Minnesotans get paid through unemployment insurance. The federal government has announced that those loans that come into states will be interest-free through the end of this year. And there is certainly precedent for this in many economic recessions. States borrow. We did so ourselves back in 2009 and paid it off by 2012. And so wanted to just share that with Minnesota, that we're making that move. And again, we will not see any interruptions in benefits. This is just a matter of making sure we can continue that program, which has been such a critical safety net for Minnesota over the past few months. With that, I'm going to turn to my colleague, Commissioner Jan Malcolm. She's going to walk through some of the health factors related to this decision and how we're going to think about making sure ongoing that we're monitoring these indicators really closely to make sure we get it right. So, Jan.
Thank you, Commissioner Grove. Good afternoon, everyone. I would like to just talk a little bit about the health context for today's decisions. I'm going to show you a couple of graphs and just note for those who are very careful students of these data that some of the data may not match exactly what you see on our website, because this, for example, is the last 2 weeks of confirmed cases in our state, but organized by specimen collection date, so it might vary a little bit from what we report in terms of laboratory confirmation date on the web. But what you see here is a pretty interesting pattern, and if we extended this to the whole month of May, the pattern would really hold, that we appear to have hit kind of a plateau with some smaller waves within it. And something rather significantly changed from the second half of April, where we were really seeing what the CDC referred to as kind of logarithmic growth, to now this pattern of more of a plateau with small waves within it. So you see that we've had several occasions of several days in a row of declining cases, followed by another uptick, followed by another downturn. So that appears to be the pattern that we're in. I'll have more to say about that in a moment. This graph looks at hospitalizations. We've talked over and over since the beginning about the critical importance of making sure that we've got the capacity to care for that thankfully small percentage of people who get severe disease and need hospital level care, and particularly critical care levels in ICUs. And so what this shows you is the pattern of hospitalizations over the last couple of weeks. And this is statewide. So I will also note here, I think I've mentioned in prior press briefings, that a couple of our hospitals, particularly here in the metro, have been very busy and have had very full ICU units and have even gone into some of their surge beds. But statewide, we're in good shape for critical care capacity, and we also have methods and mechanisms in place to look at these data daily, multiple times a day, and are in constant communication with the hospitals and have systems to enable the movement of patients around, or the load leveling between hospitals, so that those that are getting overfull can move some of that patient load to hospitals with more capacity. But again, this just shows an encouragingly stable situation that reflects the hard work of our health systems. This is the chart that looks at how testing has grown, and there too we've had some ups and downs, and it's not been as steady a pace of increase as the governor challenged us to do, but I think we've really turned a corner and are in a much more sustainable position to continue to grow from this point forward. As the governor said, we today are announcing over 11,000 tests confirmed yesterday. So you can see there the pattern of testing growth and heading upward from here. We now have, our latest estimate is over capacity for over 15,000 tests a day across the health systems, Mayo and the university, growing to 20,000 and beyond if we need it. So I'm going to talk just for a moment about what we've referred to in the past as our dial-back measures, the things that we're going to keep a really, really close eye on to measure the further progression of the epidemic in Minnesota. 5 measures in total. We have many more measures that we look at the health department. Well, we've kind of pulled out these 5 for particular focus. The first is the percentage of tests that are done on any given day that are positive, and we average that measure over a week. The second is the testing rate. The third is the percentage of cases that don't have any demonstrable epidemiologic link, that we can't trace back the source of the infection. This is known as community spread. The fourth measure is just the sheer rate of case growth, the case doubling time that we've talked about from time to time. And the fifth is a population-based measure of hospitalizations, how quickly hospitalizations are growing on a per population basis. So on the first measure, percent of tests that are positive, we're in good shape there. That threshold is we don't want to see that positivity rate reaching or exceeding 15% over a 7-day average, and we currently are at about half of that target level. The second, the volume of testing, again on a per population basis, because that's what really matters. It's not just the number of tests, it's tests per population. Our threshold is we don't want to see less than 50 tests per 10,000 residents per week. We are currently at 96 tests per 10,000 population each week, which puts us toward the top of the pack now nationally in terms of the rate of testing per population. The third measure is one that's a little more concerning, and that is the percentage of community spread. We've been talking about that a lot. Here we don't want to see community spread being more than 30% of all the confirmed cases averaged over 70 days, and we are just over that threshold, so we're watching carefully to see if that comes down in the coming days. The rate of new cases, the doubling rate, is we don't want to see our number of cases double any faster than 7 days. We're way above that level right now, and quite honestly, as our case volume has grown, this measure is getting a little bit less helpful to us, so we might replace this one with a more refined measure in the days to come. Hospitalizations here too, on a population basis, and I think this reflects some of the busyness of the hospital sector as elective procedures have come back online, and as there was some definite uptick in hospital activity over the last 2 weeks of strife in our community. So we're above the threshold on that per population hospitalization measure, but we also see that move around a lot day to day. So as I've mentioned, it appears that we may be at a plateau in case growth, but quite honestly, we won't know yet the impacts of recent events for another 2 or 3 weeks. So I'm not in a position to say we definitely know now we're going to have a plateau, not a peak. We cannot yet forecast whether we will see a reemergence of trend toward a larger peak, or whether we'll continue to see what we think we've been seeing, a series of smaller waves, or whether we'll see a sustained decline in cases over the next couple of months. That's frankly not what I'm expecting, but we have seen that in some other states that weren't really expecting that pattern. And so I can't really predict with any confidence what's going to happen in the next couple of months. I definitely can't predict what's going to happen over the longer term. That is the subject of a lot of study and debate in the scientific community in this country and internationally, what we might expect to see evolve next fall and winter. But the bottom line is we are likely dealing with ongoing high levels of COVID-19 transmission for months to come. As the governor has said, most likely until we get herd immunity or a vaccine, which is quite a ways away. Therefore, we really have to learn to live with COVID-19 and to put COVID-19 in the perspective of other pressing health concerns in our communities by striking the right balance across goals for health, including but beyond COVID-19, our economy and our societal well-being. And we're in a much better position today to strike that balance. We have more treatment resources, as we've talked about. We have more testing and more follow-up case investigation capacity. And very critically, we have more measures to protect priority populations. Our residents and staff in long-term care facilities, in our communities disproportionately impacted, and in hot spots as they emerge. And that is a very key piece of this whole equation, that we absolutely understand that we are still in a pandemic situation, that these further reopenings will increase the risk of spread, but we believe we've got the tools in place and the measures in place to carefully watch to make sure that we are in fact able to manage whatever degree of increased transmission these moves may contribute to. And with that, I'm very proud to introduce my colleague, Commissioner Lucero.
Hi, good afternoon. My name is Rebecca Lucero, and I'm the Commissioner for the Minneapolis Department of Human Rights. Now, I'm here today to specifically talk about the work for the Community Resiliency and Recovery Work Group, which I have the honor and privilege of co-chairing with Lieutenant Governor Flanagan. I'm also available to talk about any of the questions about the temporary restraining order our department filed against the Minneapolis Police Department earlier today. Let me talk about the Community Resiliency and Recovery Work Group. It's been a real honor to be able to work on that. This is one of about 9 interagency work groups designed to respond thoughtfully to COVID-19. And the focus of this work group is to center racial justice and resiliency in the COVID-19 response. The goal is to develop and implement, I broke the slides. I'll come back? Great. Thank you. But I can keep talking about this right now. So the goal is to develop and implement near and long-term strategies and guidance to best support and the recovery and resiliency from COVID-19 for Black, Indigenous, people of color, immigrants, refugees, and mixed status families. We are holding space and focusing on race and ethnicity because of how COVID is specifically exacerbating tremendous inequities for people of color and Indigenous communities. Perfect. But it's important to note that the work is always intended to bring greater justice to all of our complex intersectional identities by honoring systems, by honoring community groups that do the work to heal and provide the support to community. As a woman of color with family working in places with increased exposure, as a woman of color whose family has high rates or medical conditions that put them more at risk, this is deeply personal to me. And I work closely in partnership with community leaders who are desperate to keep our communities safe every single day and make sure we can recover in an equitable way. And COVID-19 is impacting communities of color disproportionately in Minnesota and across the country, especially for Black and Native Minnesotans. And of course, it's always important to start out explain why this is, because without adding context, it can seem confusing or add stigma. So here are the three things that is important to note. First, because of generations of inequitable healthcare and inequitable poverty rates, people of color have higher risk of multiple health issues such as diabetes, heart disease, severe asthma, and obesity. These health issues put communities of color and Indigenous communities at higher risk for severe illness from COVID-19. Second, people of color and Indigenous communities work in jobs that have always been essential and are now referred to as such. This means that communities of color are overwhelmingly not working from home. They are either on the front lines facing additional exposure or have been laid off. Many of these jobs, and this is the third thing, many of these jobs are low-wage jobs, and many folks do not have access to adequate health care or child care, compounding existing disparities and harming communities. So with that context, what are we seeing right now in Minnesota? Black Minnesotans test positive at twice the rate of the overall population and 4 times higher than white Minnesotans. And Latinx Minnesotans test positive at nearly 3 times the overall population and 5 times higher than white Minnesotans. Let me talk about that data a little bit differently. So Black Minnesotans make up 6% of the population in Minnesota, and yet make up 24% of those who have tested COVID positive. So we have been talking about this issue for a while, and I really commend Commissioner Malcolm for raising this issue consistently. I believe that there's only about 14, 15 states around the country that are talking about COVID-19 as it relates to race and providing data. So today we are continuing that quest. So we launched an online dashboard. You can see it online right now. We're providing data in as disaggregated a form as possible, and we're working on improving our disaggregated data processes within our state systems. You can go to mn.gov/COVID-19 to learn more. So I'm asking you to talk about this issue, talk about race and COVID-19, and when you do, please provide that context to prevent any stigma or confusion around it. So I want to talk about what the Community Resiliency and Recovery Work Group is doing to address these inequities. First, we listened a lot. We heard from countless community members and workers, and then we have been acting fast to respond. A few quotes to note. I drove to 4 testing sites locations today, desperate to get tested. Nobody would test me, even though I have symptoms. There are too many bureaucratic hoops to jump through to get tested. I don't know what to do and I'm scared. Or, I have a friend who does not have a car and is finding it hard to get testing. I'm hoping we are thinking about those in our communities who do not have cars. How can you come directly to our community? Or, I don't have insurance. I cannot get tested. Please help. And to each one of those people that we heard from, we have very quickly put systems into place to change that and solve these problems. We developed a 5-point plan to increase testing for people of color and Indigenous community members in Minnesota, and we are implementing this quickly. First, broad access to community tests in community sites. This is happening. We did a test run. We learned a lot. and you should start seeing a lot of mobile testing sites in the weeks to come. Next, increased testing at community health clinics. This is also happening, and I really want to stress the no barrier testing that we are talking about, so that everyone should be able to get a test that they need, no matter what. Of course, we've prioritized testing in industries where people of color are heightened exposed rates. We talk a lot about keeping communities safe by encouraging communities to wear masks. And then, of course, we want to make sure our messaging is as accessible as possible by ensuring that we are translating as much documents as possible. Let's talk real quick about that, the mask issue. In the last 10 days, we've actually provided 100,000 masks to community. In fact, yesterday we distributed half of those masks to about 65 community organizations who have folks working in community right now on the ground in Minneapolis as part of the protests, gatherings, and mournings that are going on as a result of George Floyd's death. Additionally, the Lieutenant Governor dropped off 200 masks to the memorial on 38th this week for folks who are gathering, serving food, organizing, who are not able to bring their own masks. We are committed to ensuring that folks are safe and have the space to be in community at this sacred space. Let me talk about another priority, worker protection. That was something that Commissioner Grove talked about is a really important part of this. The Community Resiliency and Recovery Group has built into it members from the Department of Labor, from the Department of Economic Development, from DEED, and they are working right now to put together trainings that are geared to and for workers, for worker protections. So you'll see these trainings in the coming week, and it's essential that employees understand what's required. Employers have to understand, and employees have to understand. That way, the workers have the information they need to do their job as safely as possible. Another priority, community organizations. You are the lifeline of our city, of our state. You are incredibly important. We are certainly being reminded of that yet again this past week. So we are working to get funding directly to organizations run by and for communities of color who know best what is needed for recovery and resiliency for for their own community. I'll also just mention again the translations, because this is important. So all state agencies are now expected at a minimum to translate COVID-19 materials into Hmong, Somali, and Spanish, unless, and also community-specific languages as well. We're doing more than just translating. State agencies are working to bring in more people who speak multiple languages to provide assistance to communities speaking multiple languages. We are striving to be responsive and representative of the communities that we work with every single day in our effort. This is what's required to build an inclusive community in Minnesota. As you can tell, there's a lot of important steps that are happening right now, and there's a lot more work to do to intentionally center those who are the most impacted here. I just will leave with a couple quotes from community members who we've been meeting with on this issue that I think are really important to talk about the resiliency that is inherent in our community. So first, we see this as an incredible opportunity. We are innovators and we work hard to serve our community. Another community member said, "We are in an era of unprecedented cooperation and collaboration amongst our orgs. We are deliberately trying to reject the colonialized model that creates incentives for us to compete against each other. This is a moment to leverage." Another community member said, "The beauty of this situation is we get to strip this house to the studs and ask ourselves if what we built was working and rebuild it." And another said, "We embody resiliency." Thank you very much.
Good afternoon. John Harrington, Commissioner of the Department of Public Safety. We've had a few good nights. And I don't take that for granted, because when we first arrived, the state first moved into trying to help the city of Minneapolis, it didn't seem like there were going to be good nights coming anytime soon. So I'm really impressed by all of the work that has gone in, work by community, work by police, work by the National Guard, work by the troopers and the DNR, everybody working together to keep the peace. And we're moving now from that place where we've had some good nights into a place where we're talking about resiliency for our communities. our community's rebuilding, whether it's rebuilding physically, cleaning up the mess and cleaning up the burned out buildings and reopening stores and tearing down the plywood, all the way back to trying to get some pharmacies open again so that grandma and grandpa can get their medicine and not have to drive out of state to try and find their medicine. So we're building our way back toward resiliency. I will tell you, over the weekend, state assets, local police, county sheriffs, military resources are staying prepared. We're going to be still out there. We're reducing our very public-facing presence, but there's going to be just as many people working to make sure that Minnesotans and people in Minneapolis, the Twin Cities, stay safe. Our law enforcement partners, we met, and we think that, frankly, Minnesotans and Minneapolis folks and Twin Cities, St. Paul folks knocked it out of the park on the curfew. Every night, it got better. First night, we had a few more folks that wanted to, I think, test the waters. Every night, it got quieter and quieter to the point where we don't see any need for the state to have a curfew. And so there is not going to be any curfew this weekend. Last curfew ended this morning. We are in agreement on that. But we will ask, just as you stayed inside and you stayed close to home and you stayed at your businesses to make sure that everybody was safe, we'd like you to continue doing that. We think that has really worked. It has allowed us as police officers to get after the bad actors without having to worry about having somebody step out into a crossfire that we didn't want them to be in. It allowed us to chase down the bad actors in cars without worrying about who was going to be in between us and them if a chase started. So we appreciate what you have done already. We'd like you to hold on to that sort of ethic of staying home and keeping the peace yourselves for a couple more days. We are going to keep the Multi-Agency Coordination Center open throughout this weekend. Frankly, this is a matter of being vigilant. I've mentioned that in my mind, while we have had some success, success is never a guarantee in my business. And so success is as guaranteed as we are watchful and aware. And so having the Multi-Agency Command Center open will make sure that the people that are keeping track and that the assets necessary to respond like that are ready and able to go. The State Patrol is going to start sending some of the troopers back to those greater Minnesota roadways where they're so desperately needed. I talked to a couple of chiefs in greater Minnesota that said they want their troopers back. I think that's partly they're getting tired of taking the crash reports themselves, but just as much as that, they want to see those troopers there because those troopers are not only highway patrol and highway safety, but they're also the backup for those local departments when times get tough. And so we're starting the process of demobilization or sending those troopers home. That started this morning. And the National Guard is going to continue its core missions here of fixed site security, but we're also starting to demobilize that. And there's a plan to move those folks forward and get those teachers and plumbers and grocery store owners and all the rest of the folks that make up that National Guard group, get them back home because, once again, their families need them, their communities need them, and we have less need right now than when we started. In addition to the assets that are starting to demobilize, there are other assets that are mobilizing. ATF, Alcohol, Tobacco, and Firearms, is on the streets working on explosions, on fires, and working with us with the local fire chiefs to make sure that those who set those fires are held accountable. The FBI is working with us and the BCA to look for those folks that we have seen out and about with guns in the night. And we continue to get those reports from community. And we're looking for them actively, and we're continuing to take information on that. We are going to continue our investigatory part of this long after you stop seeing uniforms standing guard at corners until we have held people accountable. When I was at the MAC just a little while ago, talking to the rest of the cops and the fire chiefs and everybody else, the emergency managers there, and we sort of talked about this as sort of a graduation. We arrived code 3 in an emergency, and within a day or so, we were monitoring and managing a crisis. And right now, we're moving into a place where we're prepared for resiliency, but we're prepared to be resilient with vigilance. Where we are keeping track, and we are watching, and we are prepared to respond if an emergency reemerges. With that, I would turn it back over to Governor Tim Walz. Thank you.
Well, thank you, Preston. I appreciate your patience. We had a lot of information. It's, I think, one of the bigger days since back in March when we entered into the first emergency order, and then the end of March where we issued the stay-at-home. Returning to a place where I think many want to get to. We're going to have to work together. I want to thank Commissioner Lucero on this work. Just to be clear, what everybody was listening there is the angst that you saw on the street is a whole bunch of things piled together over an awful long period of time. One of those is health disparities, and that's what you heard there. So I just want to say this work was started in April before the situation of the murder of George Floyd, but it's those types of things that need to be addressed so you don't get to that point. I would address on the curfew, I really do want to thank Minnesotans. We asked you as we took the violence off the street, and we separated those folks who wanted to tear down our communities from those who are out there to build up our communities and make it better. What I would tell you is the folks who are on the streets now, those of you who protested peacefully over the last week, changed the policies on chokeholds in Minneapolis. This is what direct citizen engagement looks like. And what I would tell you is we want to get really good at protecting that. I would encourage you, please don't quit. Please continue to lift that voice. Please continue to give the momentum to make these things happen, but let's do it in a way that we do it so we're not engaging those folks who cause problems. Let's do it in a way, just simple things of coordinating with us. One the other day is that we can help with. If we're going to have a large gathering of 6,000 people on the Capitol, and we want you to be able to do that, we need to just have a little lead time so we can get toilets there and those types of things so that it's at least comfortable and you can do those things. And if you can stay off the freeways, I understand it makes the point. If you're being heard doing it this way, and I would tell you now with the legislature coming back in, you build capitals with big front yards, not to admire them, but to fill them with citizens. That's the purpose of why they're built that way. And so I really encourage you to continue to do what you've done. Let's make sure we're continuing to keep some folks off the streets that should not be there. We'll do the work there. And I just want to tell Minnesotans, this sense of getting back, the businesses who have suffered through this, you've kept us safe, you've got us ready. We'll do the best we can. I today did my kind of first transaction other than take out food. I called ahead this week and the line was big, so I got in today. Was able to get a haircut where they had spaced out. You couldn't be in the line. Once your time was up, you needed to be there and get in. They took my temperature entering the door. It was totally disinfected. It was masked. It was a fairly large room with just 2 chairs across from each other. I was in there about 11 minutes, did a cashless transaction, and went home. And granted, some of you will take longer because you have more hair, but you will see is these businesses are doing it. They're doing it right. That type of setup gives me great confidence. I think I could assure people I would feel safe in that environment, and I do not believe that the health people would tell us this, that our chance of transmitting was relatively low in that engagement. It was very predictable, it was very small, it was very controlled. By next Wednesday, we have a lot of that going on. So let's start. Tom?
A lot of people are wondering about the logic on the numbers. You can have 250 people inside a bar, up to 250 outside, but at home you can only have 10 people inside and 25 outside. And where you could argue that people know more about the people coming in and out of their home than they do in a bar.
Yeah, I'll let Steve talk on this, and I'll come back to this again. It's the one thing it came back with, when CISA requirements on big box stores versus small box stores. Sometimes there's not necessarily, the logic is a little bit harder to follow. Jan and Steve may talk about this. I just want to be clear to Minnesotans, there's not a fix on this. If you look across the country, and I do think you need to recognize, and this is why I'm asking for some due diligence here, this puts us into one of the more open states is how things are going. But we're using lessons learned from those other states. And Steve, maybe you talk about this, but I'm certainly not going to tell people that there's not a fallacy in the logic on some of this, that we're trying to balance a lot of things. And I think it'd be a good time for me to tell you this too. When you looked at those numbers that the health department put up, you saw us as red on a couple of them, slightly red in a few areas. If we were going to go by optimal health suggestions and requirements to us, that would have been what the White House did, and there'd be yet no state, I don't believe, would have met those requirements. So I have said all along, you have to take the health requirements, but you also have to take the well-being, and you have to take the economic requirements, and some of this has to do with that. So Steve, I'll put you on the spot to explain how some of these fallacies work out.
Thanks, Governor. It's a great question, Tom. And I'd say that, the reason for the 250 cap is to prevent really super large gatherings from happening. So think about large county fairs, large outdoor festivals, large organized gatherings. 250 helps us prevent that from happening and gives a little bit of guidance to organized settings and the caps that they can reach. That's different from a social setting. In a social setting, if you're getting together with a bunch of friends, that's a social setting. There's not an organizing body. There aren't regulations. There isn't a COVID-19 preparedness plan. There's not those structures that are in place that come with more organized settings or businesses. So there's some differences there. It's not perfect. I would say in every single setting, the thing to focus on is social distancing. The caps, the capacity, all those things are there to be helpful. But really, at the end of the day, you need to make sure you can stay 6 feet apart from people. You need to wear masks. You need to keep the hygiene up. That's the thing that should guide these decisions. And you'll talk with different business leaders, and the capacity numbers are fine, but if you can't keep 6 feet across, the numbers have to be lower. I was talking to the convention center folks earlier this week, and they said they looked at their big ballroom, and I think it can take about 1,200 folks. But when they did all the math and mapped it out and looked at the tables and the differences they'd have to have in terms of distance, they thought they could really only get about 190 in there and still keep the social distancing requirements in place. That's far less than 25%, but again, they're doing that work to figure out what makes sense in that organized setting, and that should be kind of the predominant guidance.
The 50% capacity in churches, would that pertain to funerals or memorial services?
Yes.
So people can have a memorial service for a loved one up to 50% capacity of a church?
Yep, the weddings, the funerals, those religious ceremonies or non-religious ceremonies that are such important life milestones, they can proceed with that 50% capacity cap. But again, that social distancing metric is the most important one. So that's critical to look at to make sure that you organize a setting in a way that allows people to remain distant.
Would that be?
Yes.
Can you go through the organized sports? You said low risk and high risk sports, but you didn't define what are the definitions for low risk?
Yeah, and there's a quite detailed guidance document on our website that will go into what a high risk sport is and a low risk sport. Essentially, what we're talking about here is there are sports that you can play pretty easily 6 feet apart, even in a competition, right? You can play a tennis match a pretty good distance away from somebody. You can compete in a race a good amount of distance from somebody. 5-on-5 basketball is a little tougher to play competitively in a game with social distancing. You'd be a pretty bad basketball player if you try to stay 6 feet apart from the person you're trying to defend. So you can play basketball, you can practice basketball in ways that allow for social distancing, but those games don't really work. And so that's just one example, tennis and basketball. There's several others. There's a list again online, and we'll circulate that pretty broadly. Where does baseball fit? I believe baseball is still in the high-risk category. I'd have to go check the list. Yeah. And I think, the question probably will come on professional sports. We continue to have conversation with the Twins, with our other teams in the state. I think that 250 cap, again, applies to those settings, but as it relates to some of the broader implications of Major League Baseball and other professional sports, those conversations are going to continue.
I understand, Governor, what you're saying about the bit of arbitrariness in the numbers and everything, but nonetheless, you're being encouraging right now. People have been demonstrating on the Capitol. You're talking about going to George Floyd's, the site of where he was killed. These are crowds that are way above 250 people. But people out in other parts of Minnesota who maybe want to get together for an outdoor vigil themselves for this would look at these rules and say, well, this is not allowed.
Yeah, well, I'm encouraging people to social distance. No, you're absolutely right. I think it would be naive of us not to think that we are in a singular moment and a unique moment. I think many of us would understand if I tried to bring the National Guard in here and say, you're not going to have a peaceful protest of over 250, we're going to start arresting you. It wouldn't work. I'm certainly encouraging them to continue to raise their voice. I would like them to do it in a socially distanced manner. I think we can get to a new normal in this where we can do this. I just want to be very careful about not stifling that outgrowth of democracy that is a fierce sense of change. I mean, this is a perfect storm, if you will, one created by nature in the pandemic and the other created by generations of systemic racism, but the two of them are intersecting in a really bad way. So that's on me. I take the responsibility of trying to strike that balance. I think there are some folks that would say that, but I would hope they would look at it that that this issue and where they're at and in the space of the Capitol and some of them around there is simply something we have to figure out how to do in the long run. I have to be honest with you, hours and hours of late night conversations. I won't speak for Commissioner Malcolm, but I don't think I would be wrong that she expressed deep concern about a lot of these being close together and what's going to happen. So it's a good question. Yes.
Follow-up to asking about funerals and things, Governor, you were at the memorial service yesterday, so many people watched it at home, and so can you just speak to, was that sort of an acceptable, does that fit the guidelines, if you think it was a good example, since so many people watched it?
Yeah, it was certainly a good example of humanity being displayed. It was difficult. I think in that setting they did the best they could. There was seats between us unless you were with family. But it was a confined space for 2 hours with singing. I think from a COVID perspective, again, this is measuring many of these things. Denying that to happen as a healing on a broader societal well-being, I don't think would have been a good decision. But no, we probably could have done a little better as far as the social distancing. But I think, again, the candidness around the unique nature we're in, I think it had to happen. But, you know, I want to just be cognizant of those people out there who had parents or brothers or children die and had to put off gatherings where people wanted to be in there. That's real. And I don't think there's a real good answer other than we're trying to maintain in this. And this situation is of global importance as it was yesterday. But I would say to those people who are feeling that way, you have every right to feel that there's not a sense of fairness in that this situation came upon it. So.
Can I ask a question for Commissioner Malcolm? If I was listening correctly, you showed a range of options of what might happen in terms of the continued, if we're ebbing in cases and a continued decline. And one of the options was, well, it could slowly decrease over the few months. And if I heard you right, I think you said, but I don't think that's going to happen. I wondered if you could elaborate on what you think is going to happen. Have you looked at the information? Do you have a hunch on where this is going to go from here? Because it sounds like you do.
Well, actually, I was trying to communicate that I don't really. I mean, I think that there are all kinds of theories and projections, and we're watching closely to see what happens in other states. The epidemiology looks like it's different from place to place. The shape of curves, peaks, declines, plateaus. What I was sharing with you was the last month's worth of data looks as though we may be at a plateau with some smaller waves kind of on the top of that plateau. What I can't say with any confidence is whether that pattern's going to last, or whether, in fact, the climb toward a peak is going to reemerge, or whether, as we are seeing in some other places, whether we'll start to head more steadily downward in terms of a decrease in our cases. If we do head downward, the temptation is going to be to think, well, great, that's over with. But leading epidemiologists are warning us that a decline in cases may actually indicate this might be more like the 1918, 1919 flu pandemic or H1N1 about a decade ago, which had kind of what we've been seeing so far, a relatively small wave followed by a much larger wave the following fall. So all of that is just to say this is just fast emerging, and we're going to just have to continue to watch and monitor. But the point of the slides was just to say something changed between April and May. We're in a more stable situation at the present. We believe it's, I would say, more likely than not that we will stay in a situation where we're going to continue to have a fair degree of COVID in the community for quite some time to come, which is why a sustainable strategy of openings of society coupled with some really vigilant public health measures is what we've landed on.
As a follow-up to that, you've had about a month of a focused strategy in long-term care. Obviously, there's been a lot of deaths, prevalence of deaths in long-term care. Are you seeing any evidence of that strategy working? Are cases declining in long-term care? Are you seeing anything working?
Yeah, actually, we have seen some evidence of progress. We've seen a number of the number of facilities that have current cases declining. A lot of facilities who had cases previously no longer do. And just this week, we got some confirmation that if you look apples to apples and just looking at skilled nursing facilities or nursing homes, our per population case rate is less than the national average, and it's about in the middle of the pack. And the same is true for fatalities among skilled nursing facility residents. So we have a clearer line of sight into the data. We are working really hard now to get better at spotting outbreaks quicker and responding to them more vigorously, and it is starting to really show in the increased infection control practices in those facilities.
To you both, Governor, yesterday you tweeted out and said if people were at a protest, they should get tested. Our reporter, my colleague who covered one of the protests, went to go get tested herself and said she could not. So how?
Why were they not able to?
I don't know for sure.
Out of test or
I had
denied?
a similar experience, Governor, where a site said that they were only testing symptomatic people.
Yeah.
So should they be?
That's not the guidance. No, they should not be doing that. And again, we were very clear to people to try and change this. I'll let Jan to see if that information is. I just again conveying this. Our testing strategy involves a coalition of public, nonprofit, private hospitals. It's a coalition of the willing to be able to come in. We try and put out the guidance and try to have it be universally accepted across. I was very adamant about this, that I don't want people to have to say, if you don't want to say you were at a protest, what I wanted it was no barriers, I need tested for COVID. That's where I'm at. Jan, I'm going to have you address this, but that we have to fix, because if there's any discouragement about getting tested, that's what's going to be a problem. So let's figure, we got 3 people who couldn't get tested.
She was not able to get a test because she didn't have symptoms. So what do you do? What are you supposed to do? You got to go and say, I was at one of these protests, please test me?
No, that, it is very regrettable that sometimes the guidance takes a while to trickle out. I'm sorry to hear, and it's instructive to hear that several people have had that experience, but the guidance is very clear that we are encouraging people who have been part of the part of mass gatherings to go seek testing if they were in part of those mass gatherings. So we are encouraging people, symptoms or no symptoms, if they've been in these large events, to go get tested. We've given guidance to the providers that they should not require people to have symptoms in order to get tested. So that is not what is supposed to be happening. We, in addition to those kind of clinic-based systems, as Commissioner Lucero mentioned, we're also standing up community-based testing sites, which will also be no barrier. So clearly, from your experiences, we have work to do to keep reinforcing that message. But it is clearly not the state's strategy to only test symptomatic people.
Governor, for all of you, I have not ever been tested yet, and when my trooper, remember early on, tested positive and had COVID-19, I self-isolated for the time. One of the reasons is because there was a shortage of tests. Now there is not. So I will wait my 5 days and then I will go through it because I was out in these.
Conversation with the NHL recently about whether or not the Twin Cities could be a hub for a
Not recently. I've spoken with and had contact with the NFL and Major League Baseball, but not the NHL. And I think that's what we're trying to look at. And as I've told these folks, it's our intention, if possible, and it makes sense health-wise, is to have our pro sports here. So I know they keep talking about us being a hub to be able to do this. I think that's something that we certainly, if we can make it meet the health requirements, want to have happen.
But the NHL has not consulted.
They have not
you or the
personally to
commissioner.
me. No, I have not yet.
In this phase,
Yep.
I'm curious if kids will be able to have graduation ceremonies now?
Well, this is going to be a tough one, as we said at the time, because we talked about when we issued the last guidance, the first guidance, people were already thinking about it, and we said we know plans need to be made. At this time, we only know the data. It kind of goes back to this question. I think it's a really good question because as a layman on this, and you hear this, we got all these models and whatever. What good are they for if it's just, it might be this, it might be this, it could be that? How are you trying to bring those together? And one of the things around graduation, our peak was still looking that it was going to come there. And now we're at a point, and we said, we'll continue to reevaluate. They could follow the guidance that is given out for weddings and gatherings and outside types of events. I am not in any way going to think that's going to make a lot of people happy or change where they were at. But Steve, I think you get this. That's the guidance, so they certainly could do that. Sure.
Senate committee has directed the Department of Health to seek long-term care information, data on long-term care facilities and state response. They set a 5 p.m. deadline. I guess I haven't seen if that information has been delivered, but not only the Senate chair of that committee has called for that, but the top Democrat on that committee has also said he would support a subpoena. Can we just speak to whether you'll produce that information and why or why not, and the fact that it got to this point where they're threatening you, both Republicans and Democrats, with a subpoena for this information?
Well, what I can tell you is that we've got that request yesterday afternoon, and there's a lot of data being requested there, a lot of very detailed data. We're working on it. I need to get back to my office soon to check on the status of that. It's certainly our intention to be responsive to the data that we feel we're authorized to release, and to do that timely. So we certainly have every intention of responding to information requests. As you know, I certainly will be having further conversations with the committee and with the chairs. We provided, or attempted to provide, a great deal of information earlier this week that we didn't really have time to go through. So I know this is going to be an ongoing conversation.
Some of that information we feel like we can't provide when it comes to a subpoena. We talk about what happens next. If they're threatening you with that, do you feel like privacy law won't let you disclose it? What happens?
That is, I think, part of the question is what data can be shared while protecting privacy rights. I know that there's been some legal analysis of that, and if the committee doesn't feel like our responses are in fact responsive, as I think the chair said, that is an unusual move, and we would just have to see what happened. It's certainly our hope that what we're able to provide is responsive, and we don't need to go that route.
Can you clarify wedding receptions? We have a question coming in about wedding receptions, not necessarily ceremonies, but gatherings after a wedding or funeral.
Yeah, it's a good question, and maybe I should say what I should have said before, which is these guidelines, they're important, they're critical, and they're profoundly uncomfortable to create. I just want to be honest about that. This is not something that we enjoy, the sort of social engineering aspect of this, but it's so essential that we have these guidelines to make sure we can do this in a way that's safe. As it relates to wedding receptions, you would consider that in the same way you consider the wedding event itself. If it's at a restaurant, then of course it would follow the restaurant guidelines. If it's in another venue, again, that same capacity restrictions for events and entertainment of 25% of capacity, a max of 250. Obviously, the things that you would associate with a wedding around dancing and things like that would have to be taken into consideration as it relates to social distancing, because that, again, is the bedrock principle of all these things. So that, again, applies to both church and non-church settings.
This morning, Senator Gazelka gave quite a bit of remarks, his most in-depth public remarks to date. He said a lot of things. I'd like you to respond, but the first thing I'd like you to respond to is he asked that you and Mayor Frey give a public apology to the people of the Twin Cities and the state of Minnesota for what happened Thursday and Friday and Saturday with the damage. I'd like your response to that.
Well, I've said all along on this, the buck stops with me on everything that we do. An unprecedented situation in our nation's history that spread and replicated itself in other cities. My hope is, though, that the focus on progress is what Minnesotans are looking for. Seems a bit premature that a postmortem has been done on everything, and now we're going to go to that place. I certainly don't think Minnesotans want to see that. I've said all along, I take responsibility for the things we've done. You've seen us when we've made mistakes. We've acknowledged so. These are complex situations, ever evolving. I listen to the advice of my experts and commanders on the ground. I think criticizing the Guard and the State Patrol in this for strategic plans is probably not the place right now that we need, but there'll be a time and a place for that. My pledge to Minnesotans is always progress. That's what they're looking for in moving things forward.
He also said, why not just open the economy 100%? The social distancing, he said all of this complicated formula of turning the dial is just getting too much, and that the economy needs a bigger boost.
Well, that's an opinion. It's not where a lot of the science is at. It's not what the University of Minnesota showed that we had, again, separate from the model that we had saved lives. I think it's easy to coach from the seats on the side, to not have to be there. We've certainly tried to explain everything where we're at. It's complex to make the decisions. Again, if I did that and people die, I'm assuming that my responsibility, as I would take it, would be upon me. I'm making the best judgments possible based on listening to experts and watch what's helping across the country. Have data that's coming across. If it was from last week, the Defense Secretary and the Chairman of the Joint Chiefs of Staff said the operations that were carried out in that environment were the best that they had ever seen, and I'm sure we'd go on public record to say so. So I'm not in a debate about where it's at. I'm in a race to try and make sure things work, and I certainly believe this. So from the beginning, I find the irony of some of this is the denial that this was anything more than a flu, the denial we should do everything, but on the other hand, we're not doing enough to the dangerousness of using data in long-term care and trying to let the public see that there's a difference between skilled nursing and long-term care. These are private industries, and before I was governor, had no regulation of them whatsoever. I signed into law legislation making sure that these were places that had already been violating. This is not helpful at this point in time. I am more than willing, as I said again, for us to continue to acknowledge where we could get things differently, but this process now puts us on the front end. And if the senator wants to go and ask all the hospital CEOs, they would counsel against this move. And I had to take that into consideration, and I have to take the responsibility and the risk. So I get all kinds of ideas thrown out there, and when they don't play out, for example, keep the curfew on, keep it longer, and keep it indefinitely. Okay, what happens if that leads to more rioting? Then you take responsibility for that. Be a heavier presence. I think it was a very poor decision, and I think we saw it played out when the suggestion last week was to use the 82nd Airborne and to federalize troops here, when you've seen an outcry from every retired general and everyone that the law that I wrote, that I put in 2008 as a member of Congress on the Insurrection Act to stop that, that was the solution last week. That was the solution. Call the 82nd Airborne, and I didn't do that. That was the wrong decision. This is not helpful to throw those things out. We should be working together to find those places that work. And I am confident that this move on the economy puts us in a place, because we're going to have to operate indefinitely in a sustainable mode. And if you throw it all open, I would give you this. The state epidemiologist in Sweden is under a lot of fire and backtracked from their decision and said we were wrong. It's somewhere, and actually he didn't say we were wrong, and he said something very, I think, telling on this. He said, I think it's probably somewhere in between what the Western nations did and what we did. It was probably somewhere in between. And I think we've got 90 days of data now. And I think that's the thing as we start to track it and see patterns. 90 days of data in the scientific community is nothing. It doesn't prove anything. So, sure.
Can I ask about the court order? A question was about the penalties for violating, whether a chokehold is performed or something else that's in violation of this order. What are the penalties and who's enforcing them?
That's the city council. I did not see that. And are you familiar with that? Okay, very good.
Yeah, thank you. So just for a little bit of context, today the Minnesota Department of Human Rights filed an emergency court action and a proposed court order that details immediate changes that must be put in place. These changes are designed to stop ongoing irreparable harm to Black, Indigenous, and communities of color who have suffered generational pain and trauma as a result of systemic and institutionalized racism. Every one of the changes that were put forth, including the chokehold provision, come directly from community and have come directly from community over and over and over again. As Minnesota Civil Rights Enforcement Agency, we are committed to doing more. When it comes to the ban on chokeholds, I just want to explain what's going on there. Currently, chokeholds and neck restraints are permitted. In fact, in the policy and procedure manual, it is permitted under a variety of situations to utilize a chokehold to even render someone unconscious. So with this change, chokeholds and neck restraints are prohibited for any reason. This requires the city to amend its department policy and procedure manual to make that change. If this isn't done, then there would be a contempt of court, and the court would have broad latitude to be able to implement changes or enforce as they see fit, given the circumstances that come before them at that time.
Thank you, everyone. A lot of news. I know we put a lot of it out there. Historic news around civil rights changes and policing, a sense of urgency around these issues, a unique opportunity. By all accounts, more than likely, we will be back in special session next Friday. That gives us the opportunity, and again, I can't stress this enough times, nothing that's being proposed in these changes is anything that hasn't been around in many cases for decades. Nothing that's being proposed isn't working and has data to support it, whether it's in Camden, New Jersey, or other places. Nothing that's being proposed is being formulated in the dark or in a room. It's by community activists and experts on this. And so as we watched and as the Floyd family grieves, Minnesotans are on display to the world. I think I've heard this time and time again. I heard it on Lake Street. I heard it up on Broadway. I'm hearing it in every conversation. Our opportunity for the legacy of this state is to be the place where all this begins to change, where the big ideas start to happen, where people who are looking to change things that did not seem possible a week ago are now on the horizon that can be done. And so I would encourage you tonight, the curfew is off. Our businesses are opening. They are preparing for next week. I saw the University of Minnesota talking about in classes in the fall. We're already thinking that way. We're thinking forward. COVID is still with us, but we got to live with it. And we have to figure out ways. And I would encourage us working together, changing course when we need to, staying firm to who the values and who we are, and being able to recognize, for whatever reason, history has put this entire state in this position, and it's for us to decide what we do with it. And I've said this time and time again, Minnesotans don't fear history, we make it. Now's that time, so thank you. Thanks, commissioners.